And I want to shift gears a little bit and start to look at some of the state specific resources that you all can refer to throughout Kansas and Missouri and Oklahoma. One of the first places I always go, outside of just kind of my legal research tools, but as a place to get a general orientation on different topics in different states, is the Center for Connected Health Policy. They have, as you can see, topics all over the place for telehealth. You could toggle to federal rules and requirements for the Medicare program or general Medicaid requirements. I often use it for state specific requirements as well. So if I toggle to the state of Kansas, they have broken down telehealth concepts by several key topics. Changes in the state of Kansas that are specific to the COVID-19 public health emergency, or the state's version of that, the state emergency declaration, which has expired in all three of our states, Kansas and Missouri and Oklahoma. But these links send you to Medicaid resources specific to the state of Kansas, different policies, different provider bulletins. So I think that's an incredibly helpful resource. Oh, meant to go back to my main page here. Yes.
Richelle, I got a
Yes.
question directed to me. So the question is, does the federal register pertain to Medicare, Medicaid, fully insured employer-sponsored plans, and self-funded employer-sponsored plans? So for example, the list of covered telehealth codes approved on the fee schedule states list of Medicare telehealth services effective January 1st, 2023, updated November 1st, 2023, I'm guessing. Or
Yes. Okay.
2022.
So it's a great question. And let me try to restate it and make sure I'm capturing it correctly. What I think they're asking is what's in the federal register that will translate into federal regulations and a list of covered telehealth services and when and how they're covered. What does that apply to? That Federal Register document that we were looking at is part of the Medicare program. So they were asking about fully insured or self-insured plans that may be covered under federal ERISA health plan benefit rules, are not subject to the rules and requirements in that Federal Register and regulation that we were looking at. So under the ERISA regulations, which is a federal law that governs self-funded insurance plans that are not covered by state insurance laws, those health plans get to decide their telehealth coverage. And it may vary in terms of the scope of what they cover. The list of covered telehealth services can be plan specific. The spreadsheet we looked at for Medicare is not binding on a self-insured health plan that's covered under federal ERISA rules. And Jennifer, if you see a follow-up question on that, just jump in and let me know, because that's a great question.
Yeah, of course, I will.
So I looked at the COVID-19 flexibilities and some provisions that came about with respect to telehealth in the state of Kansas as part of the COVID-19 public health emergency. But then this gives us resources on statutes and regulations under state law or state administrative regulations and rules relating to telehealth outside of Medicaid, outside of the Medicare program, but these may be rules for general commercial insurance plans. So Jennifer, that could be our third-party administrators, our plans that are governed by state insurance laws rather than federal ERISA laws may have to follow these rules and requirements. This is where we can also find across the states information on service parity, meaning health plans have to cover services in a telehealth format the same way that they would cover them in an in-person format, and payment parity, which is paying them at the same rate, not just saying, yes, we will cover them, but we will also then pay them at the same rate. So you can find information on Kansas, Missouri, Oklahoma, or any other state if they have service and payment parity statutes and regulations. This is a great place to track down exactly where you can find that rule or requirement. Where have used this is not only to answer questions about whether service and payment parity exist in a state, but also to help in kind of payer disputes or a policy that a payer may roll out that looks like it might impact service parity or payment parity in a state where a provider is located. And by referencing these statutes and regulations, it may prompt a question back to the payer to say, hey, this looks like in our state that might not be allowed, or how would it apply in the state of Kansas or Missouri, et cetera. They have a section dedicated to Medicaid rules and requirements in each state. And again, this is, we would do our research by going to the Medicaid program and pulling up the manuals and pulling up the policies. They do a fantastic job of keeping this pretty darn current, but it's a fantastic way to just give you an insight into some of the high level topics to think about, like the form and format, like consent requirements, how do we handle out-of-state providers, and so on. Now, professional requirements, this is talking about the licensing rules in each state. Also, I think incredibly helpful where this has changed so much during the public health emergency, and states have left off in various levels of interstate licensing compacts. We did a session on that with Diane Belquist that if you've got providers rendering care in multiple states, you may want to go back to HTRC's website and review that session. When a provider needs to be licensed in a particular state, like when do they need to be licensed in Kansas to provide telehealth services, and just how all of the licensing requirements work. They've been progressively adding more and more types of licensure rules. So traditionally, this had touched primarily on physician licensure. Now, as you can see, if there are rules and requirements for different types of professionals or facility types like a home health agency, the Center for Connected Health Policy has been adding those statutes and those regulations as well. And adding sections for, if there are any, FQHC, RHC specific details. So I'm going to flip over and just show you the similar page. This is the Missouri specific page. All I did was go to state and select the state of Missouri to get this page. You can see they've got the same categories of information, but they're going to have the updated references to Missouri's statute or Missouri's regulation or Missouri's Medicaid policy document for each of those different categories. And we can do the same thing for Oklahoma. Again, I just went to state, select Oklahoma, and you'll see the same categories, just updated references so you can refer to the state's specific statute, regulation, or payer policy. So now I'm going to go to our state specific policies. I'm going to jump over to the state of Kansas. Now, the state of Kansas Medicaid program has revamped its website. I'm trying to think when it was updated, within the last several months. And if you have tried to go out and search online and find the Kansas Medical Assistance Program, provider manuals or policies and procedures, it's really difficult just to go through a search engine and find these new references. So I have bookmarked this one because I'm on it so much and it's so hard to just Google and find. You may want to do the same if you're in the state of Kansas or you're involved with the KMAP program at all. This is the main page that's going to take you to kind of the provider site for the KMAP program. And on this new provider site, if you hover over the word provider, you can go to provider publications, provider documents. This publications tab is the one that I find to be the most useful, the one that I am in the most. This is where the provider manuals, any forms, any provider bulletins would be published. So I'm going to start by looking at the publications and going to the provider manual tab. And under the provider manual, you select this drop down, and based on the service type or the provider, you can select the provider, and you have historical provider manuals based on their date of revision. So if you're trying to look and see what was in effect last year, maybe you've got a post-payment audit or something that you're looking at, you would pull up previous versions, or you could look at the current version. And within those documents, you can do a keyword search for like telehealth or telemedicine and find the entries that are specific to that topic. I'm going to go back to the main page here. You can also search the KMAP website, but I want to show you a trick to doing this. If I search, I saw they're using the term telemedicine instead of telehealth. If you search for telemedicine, when you scroll down, you're going to see things that have nothing to do with the Kansas Medicaid program, Medicare websites. So if you go to the top, when I searched, right now it has all selected. So this is almost like a mini Google. It's searching the entire internet for that keyword search. If you toggle to KMAP instead, it will then search only the KMAP documents and resources that have that term in it. Or you could filter it to documents if you're wanting to search documents. So now you can see a lot of provider bulletins, updated policies that involve telemedicine by searching there. So that's really the key. If you're wanting to find Medicaid specific, make sure you toggle off of all onto either a KMAP page or document search. Okay, so we looked at manuals. Then I wanted to go to the bulletins. This is under publications, and I selected provider bulletins. You could search by telehealth, or you could search by telemedicine. There, you can see when we were in the manual, they were using the term telemedicine. In some of these documents, they're using telehealth. So you may need to search for both when you're looking for a particular policy, because KMAP hasn't been using that term terribly consistently. You can see we've got a new policy that came out in February, on February 24th, allowing lactation counseling via telemedicine. So we could pull up that provider bulletin and see the provisions of coverage. It tells us how to bill for it. It tells us the place of service to use for that newly covered service. The other thing that is interesting, after that 2023, look at these dates. Really, nothing has changed. Not much has changed since very early on in the public health emergency. And these are going in, I believe, descending order based on date. So that was the biggest bulletin change. The rest of these continue at this time, continue to say until rescinded. And we haven't had any update to indicate that they have been rescinded at this time. So now I'll switch over to the Missouri Medicaid, Missouri Health Net, and their main provider page. And you'll see similar types of documents, right? Provider bulletins and hot tips and manuals. So I'm going to open up a couple of these in new tabs really quickly. And we'll go to provider bulletins, also listed in descending order. So you can search by keyword. Okay, so our most recent bulletin update was in July of last year. Oh, good, a rate increase. Not very often we get one of those from Medicaid. So our originating sites are going to pay, were paid a little bit more money effective July 1st of last year. And let's see how far down they go, down to 2021. Before, you would have to go to the archive bulletin. So on this main page, this is only showing the last year or two. If you wanted to search by topic, you could go to topic and search for telehealth. Let's see, 18 different options when we can find bulletins and policies. Or you could go to the archived bulletins page. Now this one, you will see the scroll bars a lot smaller because it goes down to a lot more historical bulletins all the way back to 2003. So if we were to do a keyword search for telehealth here, we're going to be able to see a lot older documents and the evolution of those payment policies historically. So that's our bulletin page for Missouri Medicaid. The hot tips page, this was where earlier in, losing track of my years, I want to say 2022, when Missouri's state emergency declaration was allowed to expire December 31st of the previous year. This is where the agency came in and gave us an update on how they were going to handle changes to telehealth at that time. That's probably going to be on an older hot tips page. Looks like we have some updates February 1st of 23, but on updates for telehealth, the partnership between the Missouri Telehealth Network and Missouri HealthNet. And we can take a survey. Let me go back to 2022 hot tips over on the right will take us to previous years. There we go. Telemedicine here to stay. And you can search for all of the previous year's hot tips over here on, on the right by year, or we can do something similar by going to the telehealth topic index and doing a keyword search for telehealth as well. You can see there's that telehealth here to stay that we already looked at. There was an update a little bit earlier in the year. This will show all of those previous years' telehealth hot tips. And then the provider manuals page. So you can go into the provider manuals. And this is another one that says physician, but this is for the most part professional billing. This may be APPs, nurse practitioners, physician assistants as well. See if I type in telemedicine instead of telehealth. There we go. So we have a whole section in the manual on telemedicine services for Missouri Medicaid as well. What you have to, the eligible provider requirements, how they get paid, documentation expectations. All great resources to go to if you're doing telehealth for Missouri Medicaid. So Oklahoma, I think I always pick on you and put you last, but we're going to switch over to the Oklahoma Medicaid, the Oklahoma Healthcare Authority website and their telehealth homepage that tells us some of the basic requirements for telehealth to be covered under the Oklahoma telehealth program, or Medicaid program as a telehealth service. And they've got some tools and links, but the policy link takes us to the state regulation defining telehealth services. So some of the same definitions that we saw from like HHS and how they define store and forward technology, how they define telehealth services, actually adding remote patient monitoring specifically as a telehealth service that's covered in Oklahoma, and all of the rules and requirements, all the way down to the modality, audio and video, but also consent requirements and how those work in the state of Oklahoma. That second resource link, let me go back to our main page. I just clicked on the policy link here that takes us to the regulation for the state of Oklahoma. This first link takes us here, explaining what some of the expanded flexibilities were in the state of Oklahoma specific to the COVID-19 public health emergency. So review this if you're in the state of Oklahoma to understand what might be changing as the federal public health emergency winds down effective May 12th, and how that may impact the telehealth services that you're providing in the state of Oklahoma. Oh, and that was just my 2022 list of telehealth services. So let me pause there. I'm going to come back to my slides and see if I missed any important resources for you, and see if you've got any questions in the chat that I can help answer about resources for telehealth, where to go, where would I find a particular reference material that you may look for in your own telehealth services.
We did have a additional quick question from the original question that Jennifer posed earlier.
Sure.
Commenter says that it was very helpful regarding the self-insured. When we have a minute, can we clarify this for fully insured plans as well? Or is that state regulated specifically?
Yep, that's a great question. So the self-insured plans are typically going to be governed by federal ERISA regulations. If it's fully insured, those are typically governed by state insurance regulations. So let me come back to my website here. And when it comes to state insurance regulations, this is a great place to start. The Center for Connected Health, and in particular, our professional requirements. That's licensing requirements for professionals in the state, and then private payer rules in the state. So coverage parity, service parity, those types of things in the state. If a fully insured plan is a licensed insurance plan in the state of Kansas, same thing in Missouri, same thing in Oklahoma, then they would have to follow the state insurance law. Now, let me come over here to my search engine and Kansas Department of Insurance. This is where you can find information about not only the insurance companies that are licensed to do business in the state, your major payers, Aetna, Blue Cross, Cigna, Humana, United Healthcare, but also smaller companies and networks that may be providing services, as well as third-party administrators who may be administering health plan benefits for other insurance plans, can be found here. And this is going to have information on what's governed under the state insurance laws, what types of health plans specifically. So you may see on this page, or you would see on this page, it excludes workers' compensation, which is governed by the Department of Labor. It excludes fully self-funded plans that are governed by federal ERISA laws. It would exclude the Medicare program, which is governed by federal Medicare laws. But things for fully insured plans that do fall under state insurance laws, this is a great resource for prompt payment and some of those other state insurance rules and requirements that can be a resource, as well as a possible enforcement mechanism if it looks like a payer may not be following the service parity or the payment parity rules and requirements. You're going to and I'm looking at the Kansas Department of Insurance. You can do the same thing for the state of Missouri and the state of Oklahoma as well.